national opioid crisis. The president says he will declare a state of emergency to help combat the epidemic that is affecting the country.
I want to get that absolutely right. This country, and frankly, the world, has a drug problem. The world has a drug problem, but we have it, and we're going to do something about it.
This comes as the Department of Justice is set to make an announcement later this morning in its effort to stop deadly opioids from illegally coming into the United States. Joining us right now is pharmacist and president of GoGoMeds.com, Ron Ferguson, president and CEO. Ron, good to see you. Thanks so much for joining us.
Thank you for having me.
So how do you get this under control? You're a pharmacist.
I think with President Trump declaring a national emergency, if that's what he's going to do, is an excellent thing to bring attention and resources to help combat the problem. It's a problem that's affected nearly every family in America.
Should this be regulated? I mean, some big pharmacy chains are limiting the amount of opioids that you could actually dispense. But what else can be done? Is that the answer, just limiting what you can sell at the pharmacy level?
Well, both supply, maybe limiting the pharmacy level, but also helping on the addiction space. And once someone is addicted, getting them the proper treatment so you help both the supply and the demand would be beneficial for the country.
Where are you seeing this problem most concentrated? Is it happening in big cities? Is it happening in rural America? Where is the core of the problem, and how does that affect how it gets addressed?
You know, unfortunately, I think pharmacies and pharmacists see it happening all across the country. It doesn't have a boundary to cities or country. It's happening in both areas, and so it's unfortunate. So once we get a handle on both supply, maybe what's coming in from Mexico and China, I know President Trump's talked about that. That'll help, but also good treatment for people that actually fall victim to heroin addiction.
So Dr. Ferguson, it sounds like this problem is, doesn't have a class or a gender or anything sort of like that. Is it because the nature of the way these medicines are made in the pharmaceutical companies? Why is this happening like this?
I mean, you get prescribed an opioid.
Right.
And then what happens? I mean, you have a longer dosage than you should have, or what?
It's easy to get addicted.
How are you turning to heroin?
Well, I think there's a certain number of people, if they've been prescribed narcotics for any type of pain, a pain due to an automobile accident, a sports injury, once they have that injury, and if they still have pain, but there's limited ways to get pain control, there's a certain segment that may try another option like heroin. The bottom 10% of the pie that you're looking at. So the problem is, once you go that route and just one or two doses, the person's addicted, and you can't resist. So it's a disease where that person needs help once that happens, because they're not able to kick it on their own.
And I don't think anyone would deny that this is a crisis. The question I would have is, what does a declared state of emergency actually do? Is that a game changer? What's the difference between, if they in fact declare it a state of emergency, between that versus the status quo now?
I guess I would hope that President Trump does declare a state of emergency, both to draw attention so that hospitals and treatment centers work together, so it brings resources to the country to help combat the issue. Because I think
awareness and money.
Awareness and money will help the situation.